Some men tend to avoid the doctor, and since next week is Father's Day and June is Men's Health Month, we brought in Dr. Neal Palafox, a professor at JABSOM, to find out what things men should focus on when it comes to their health. Aloha, doctor.
Glad to be here, Kanoa.
Yeah, thanks for joining us. Tell us a little bit about yourself and the men that you treat.
So, I'm a family physician by training. I'm a professor at the John Burns School of Medicine, Department of Family Medicine and Community Health, and also a professor at the University of Hawaii Cancer Center in cancer prevention and control, and with the University Health Partners as well. And so the men that I treat tend to be of all ages, and so it's the young men from late adolescence, 18, 19, all the way to the centenarians, 100 and so forth. So being a family physician, we see that entire spectrum, and also see men from all cultures, Pacific Islanders, Native Hawaiians, Micronesians, Filipinos, and so it's the entire spectrum of men that we see at our clinic. Unlike a majority of women, men tend to be real tantaran. They think they have everything under control, so they don't like to see physicians, they don't like to seek help. In general, men live a lot, about 5 to 6 years less than women.
Okay.
In the United States, actually all over the world. And it's because some of it's genetic, but some of it is because their health-seeking behaviors are much less than women's health-seeking behaviors. Men carry weight here in the center, and the type of weight, that kind of fat distribution has more negative effects on health. And a lot of men say, you know, I'm all good, I'm healthy. If you're standing up straight with your shoulders back, if you look down, you should be able to see your toes. Many men can't, and that is a big risk factor for heart disease, for obesity, and it's even a risk factor for some cancers.
All right, doctor, so what are some preventative steps that men can take?
So the basic preventive steps is, one is get your colon cancer screening early, your skin cancer, and men have definite prostate needs, so get your prostate, discuss it with your doctor. Think green while you eat, think balanced, and think in moderation. And also think low salt, low sugar. If you can capture that, then I think from a prevention standpoint, plus exercising minimum of 20 to 30 minutes a day, that's kind of the golden rules that we use for men and actually anybody.
All right, doctor, so how can someone make an appointment?
There's 2 clinics which we work through with, and they're both aligned with University Health Partners. One is in Mililani and the other one is at Palimomi, and they're both outpatient clinics.
All right, doctor, thank you so much for joining us, and we'll have more information posted on HiNowDaily.com.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.
Medical school is an incredible goal, but knowing what to expect can be critical when making such a major decision. Today, we're here at the John A. Burns School of Medicine hearing from a third-year medical student about her journey and all that comes with it.
When I was 5 years old, that was actually when I first got interested in medicine. I had my first asthma attack and I went to Kapiolani. When I went there, they gave me what I thought was a magical medical kazoo. It was a nebulizer, and after about 5 to 10 minutes on the nebulizer, I went from not being able to breathe to breathing freely. And for me, that was a moment when I first thought, medicine is magic. But now that I've gone through the first and second year of medical school, I learned that there is science behind that magic. But what is still magical to me is how medicine can still make such a big impact in people's lives. Hi, I'm Lucia Amore, and I'm a third-year medical student at the John A. Burns School of Medicine. So the first 2 years are more school-based, so it wasn't too much of a change from college, except that it's the hardest I've ever worked, but most fulfilled I've felt. The third year is when we're going to be out in the clinics. We're going to be learning more about the things we learn not from books, but from experience. The John A. Burns School of Medicine was my dream school. In all the things that we can do here and all the ways that they care for their community and their commitment to keeping our doctors here in Hawaii to serve our community. I'm actually from Oahu, born and raised. With the cost of living in Hawaii, I wouldn't be able to make it on my own. So I'm very happy that I have my family to help support me. The in-state tuition is very affordable compared to other medical places. One of the other things too I like is how Ohana. It feels our teachers, our mentors, who are physicians here in Oahu, they're very caring. They take the time and they volunteer to be our teachers. One experience that kind of sums all of it up is when I did my community health with a home clinic. That clinic taught me that no one is truly an island. Whenever we approach one patient, we have a whole team of people who are there, who are able to help the patient. We have nurses, we have doctors, we have social workers and mental health workers. You have an Ohana style of medicine for people who are very Ohana-centered. If you're considering medical school, start as early as you can, but don't necessarily feel rushed. There are a lot of people who find their way to medicine through various different paths. A lot of my classmates have different backgrounds, and all their different experiences that brought them to medicine just make them a stronger doctor because of it.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.
Educating doctors and conducting leading research are some of the amazing things happening because of the partnership between John A. Burns School of Medicine and University Health Partners of Hawaii. So joining us to talk more about this are the school's dean, Dr. Jerris Hedges, and CEO of UHP, Larry Shapiro. Aloha, fellas.
Aloha.
Wonderful to have you here with us today. Thank you for joining us. Dean Hedges, I'm going to go to you first. What are some of the things JABSOM is currently working on to positively impact healthcare in Hawaii?
Yeah, thank you for asking. The school, of course, is committed to training the next generation of practitioners for Hawaii. But in addition, we're creating new knowledge, doing research relevant to the people of Hawaii, and we're working hard to move our educational programs out to the neighbor islands so that we can be sure that we meet the health workforce needs here in Hawaii.
Yeah, very important. And UHP supports the medical school in the creation of new physicians as well, right?
Yes, UHP is the faculty practice for the doctors who teach in the medical school at JABSOM. We're a not-for-profit organization that provides the support for the educational and research programs at JABSOM. We have about 160 physicians who work with UHP and practice, seeing patients in real-world situations so that our learners can get experience in those kinds of circumstances.
Yeah, really hands-on, yeah. Faculty practice plan, what is that about and why do you think the school needs this?
Well, we work very well with many parties in the community, with the hospitals, independent practitioners, but there are some central elements that we need for accreditation and for making sure that we have a uniform educational process. And one of those items we need are strong academic departments which have clinicians committed to advancing knowledge and teaching our students, residents, and fellows. So having a practice plan is vitally important to the school. The committed efforts of these practitioners provide support for their academic department and also investment in the operation of the medical school. And without that, it would be very hard to do the services we do for the community, such as the homeless outreach medical education home project, and also the support of growing practices on neighbor islands like we're doing with obstetrics and gynecology in Hilo.
Dr. Shapiro, what kinds of doctors do you have in the faculty practice?
Well, we try to focus on the kinds of doctors that Hawaii needs. And of course, there's a great need right now for primary care physicians, and so our departments of family medicine and internal medicine are busy training and educating new physicians.
All very important roles, of course. Thank you so much for joining us today and for this very important partnership. For more information, we'll have this up for you guys on HiNowDaily.com.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.